Okay, so far we've looked at the mental health crisis in America. Here's what we looked at so far: the current state of it, the causes for it, how common it really is, and that a real problem does exist in our country. We've also looked at how science supports these issues and how it backs mental health in America. And then we've also looked at the stigma issues and the impact it has on individuals. And we've taken a look at also the how we're tackling this issue. So now let's focus on this slide, which is what resources would be needed to implement the solution. There's four things to that. So number one would be dissemination and implementation of evidence-based programs. This would be with medication or assisted treatment, such as buprenorphine, which has been found to really assist with that and really help some patients, or an extended release injected naltrexone, which also has been proven to help a patients with mental health. And then number two would be creation of portals of entry of all in need. For example, portals of access to mental health care in the public and private sector, such as providers, payers, patients, and employers. Number three would also be alignment of financing systems with assessment of outcomes and value-based care. This could include amendments to existing or new legislation that would encourage alignment of insurance finance systems to new models of mental health care providers. And then we could also have the modernization of health information technology. So, very important that we know what the role of health information technology does in healthcare. It provides us the information that's needed for a patient, the care they received while under the providers, and what the outcomes were. So improving that aspect would greatly benefit the patients of mental health, and also if we can train in that area, it would also achieve cross-provider collaboration for the again the benefit of the patients of mental health. So four things to that. So those are the resources that would be needed to implement the solution.